The future of AI in medicine, I think that's a really loaded question. I think we have a lot of really great opportunities to explore and utilize AI. I think more specific than what do I think AI is going to do, it's really more about the concept of how we want to approach it. I think Dr. Joyce Lee had some great comments around the really important questions we need to be asking ourselves as we identify how will AI work and how will it be successful, so that it's not just another technology tool that we're adding to our repertoire, but that we're really using it to solve clinical problems and applying it where necessary and where it makes the most sense, as opposed to just saying, well, this is AI, that's where the future's going, so let's use it for, solving all our problems. It may not be the case. So I think, I am excited to see where AI is going to go, but it's gonna take some time to flesh those things out. And like I say, I think it's really important to ask ourselves right now, what are the questions, what are the problems we're trying to solve? So cybersecurity is a team sport. So what I mean by that is you need a leadership role to help communicate and advocate for the needs for cybersecurity across an organization, including board level and senior team level education. Then you need experts in the area of cybersecurity to be able to identify and then work with teams to implement great technologies. I think community-sized organizations really have an opportunity to explore vendor-partner relationships where the expertise from those vendor partners can be solicited and utilized in focused efforts, because not all organizations are going to be able to afford to have an expert like that on their staff all of the time. And then it just needs to be at the forefront all of the time. It needs to be a core part of the investigation that you do as you explore new technologies, new applications, even new clinical products. So many of them are really basically small computers that we're using with our patients. Every part of that assessment has to include, well, what's the security of that? What's the risk to us? And what are our options for mitigation? Knowing that there is no foolproof way in cybersecurity to defend yourself. So it's about educating, discussing, creating as much defense as you possibly can, but also understanding where you may not be able to have a complete defense and educating around what those risks are and if something happens, how you would mitigate them. I think all organizations are struggling with how to prioritize the work that we need to do around cybersecurity. And I think what we really discussed yesterday is you have to take a parallel approach, addressing multiple different elements of cybersecurity, whether it be multi-factor authentication for the end users, or segmentation and microsegmentation of the network, or a variety of other, threat hunting tools. You can't be putting all of your eggs in a basket and doing just one and perfecting it. You really have to be swimming in all of those lanes at the same time. And then while you're working through all of those things, you need to be advocating and educating across your organization to help people understand the importance of creating a cybersecurity infrastructure